State Action for Community Equity, or FACE, is an organization of 23 faith institutions, 2 community associations, and a bargaining unit. We come from diverse ethnic, religious, and socioeconomic backgrounds. Our purpose is to improve the quality of life for all by finding common ground to get work done. Therefore, we are a people of faith, seriously engaged in public business. So, why are we here today? You may have heard or even experienced family, relatives, or friends being denied care by doctors and hospitals because of the type of health insurance that they carry, like Medicare, Medicaid, or Quest. You wonder why and ask, can they do that? Some people say that Medicare reimbursement in Hawaii is the lowest in the nation. You have also noticed that hospitals are struggling to survive, and those who
Now, there was a fearsome federal barrier in the way of any state's attempt to adopt a comprehensive healthcare plan for its people. That barrier was and is a federal law known as ERISA, the Employee Retirement Income Security Act of 1974. It said, and still says, that the provisions of ERISA, quote, shall supersede any and all state laws insofar as they may now or hereafter relate to any employee benefit plan. There are some important exceptions, like the regulation of insurers, but they are very narrow and hard to use. What that means is that if a state law trying to improve health care for its workers relates to any employee benefit plan, then it will be declared void and preempted by the federal law, ERISA. Anyone who gets their health insurance benefits from their employer has an employee benefit plan. And any state that tries to legislate about that, any state law that tries to change that is void and of no effect because it is preempted by ERISA. So how is it, you may ask, that Hawaii has a mandatory prepaid health plan applicable to all employees who work at least 20 hours a week? Doesn't that relate to employer health plans? The answer is yes. The answer is that the Hawaii Prepaid Health Care Act was taken to federal courts, and those courts, from the United States District Court all the way through the United States Supreme Court, upheld ERISA and struck down our Prepaid Health Care Act, held that it was preempted by ERISA and void. So how come we have one now? That's because our congressional delegation went to Washington and succeeded in getting Congress, the United States Congress, to amend ERISA to exclude our Prepaid Health Care Act from preemption. Hawaii, and only the state of Hawaii, has an exemption that we got around 1975. It says that our act can exist and it will not be preempted by ERISA. But what happens if we try to pass some new laws changing our Prepaid Health Care Act, or maybe trying to expand it or shrink it to either reduce or increase the coverage or the costs? Well, the same law that gave us our exemption also says this, and I quote, ERISA preemption will continue to exist for any amendment of the Hawaii Prepaid Health Care Act enacted after September 2, 1974, to the extent that it provides for more than the effective administration of such act as in effect on such date. So the only amendment we can make without running headlong into ERISA is purely to improve its administration. We cannot change the merits, okay?
in a sort of situation now where it is very, very difficult for me to recruit young doctors to come to Illinois. And trying to recruit doctors to go to Kauai or go to Molokai is extremely difficult. I tell you that the economics of it can be very, very difficult. Those are the kind of things that as a community we have to look at and say, you know, are there ways that we as a community subsidize young doctors to go out to those places, make those sacrifices? Is the money that we get for Medicare and Medicaid what it should be? I think I would argue that it's not. It hasn't been revamped in many, many, many years. And it's the sort of thing that does not take in the cost of living, does not take in the cost of doing business. Reimbursement is driven off of what we as a society choose to pay for healthcare and what we as a society choose to make a priority. I do think that as a community we have to look back at ourselves and say, what are we willing to sacrifice in order that everyone in our community has high quality, accessible healthcare?
We face other problems. The waitlist issue. The waitlist issue is a very serious issue now for our hospitals. Our hospitals this past year lost $80 to $95 million on waitlist. Now, what is a waitlist problem? The problem is this. We have a patient over here at Queens or any other hospital who really has had the treatment they needed there, and they don't need to be there anymore. And they could be sent to a nursing home or to another community-based care home or something like that. However, at one time, about 6 months ago, we had 365 patients all across the state that were sitting in acute care hospital beds that didn't need to be there. Now, this is bad health care for each and every one of you. Because what if you need that bed across the street in Queens, God forbid? But let's say you do. You may not get that bed because there's another patient who really doesn't need to be there, but has no place to go. They're still a little too sick to just send them back home, so you send them to the nursing home. But they're a little bit sicker than perhaps the other nursing home patients there, so they have to hire staff, bring in equipment and stuff like that, and they just can't afford it because the government is not paying for the cost of the care. And that's why we find ourselves with this huge waitlist problem right now all across the state.
HHSC, not a familiar name to you. Where does it fit into this overall picture? We use the term safety net. Safety net. The Constitution of Hawaii ensures health care for all our citizens and our visitors. You deserve that care. You're getting that care now, but it's really being stressed in a lot of areas, particularly on the neighbor islands, particularly in the long-term care environment. It's an organization that's essential for the quality of life. It's something that everybody here deserves, and we go back to the other two speakers. There are financial issues. Now, we're all about quality. Bottom line, today you're getting quality health care. There is no other kind of care than safe patient care. You deserve nothing less, and you have to have that. We've got to work together to ensure that's our future.